right, now we'll be testing lateral rotation of the hip. So you're gonna have your patient in proper posture so that the hip pelvis is stabilized, and 90 degrees of hip flexion, 90 degrees of knee flexion, 0 degrees of abduction and adduction. You'll have the contralateral leg flex past 90 degrees. You'll have them hold it there, and if their ipsilateral hip cannot be in 90 degrees of flexion, staying normally, you would put a sheet or towel underneath to make sure that it is in that position. So for this one, you're gonna palpate the anterior patella, because that's where the fulcrum of your goniometer will be. And you're gonna block the distal femur. And your proximal arm will be perpendicular with the floor, and your distal arm will be with the anterior midline of the lower leg. So I will take my hand and move his lower leg towards his contralateral leg. And there is where I feel the infill. And then I'm gonna move the goniometer into the anterior midline while holding his leg up, and right there is where we have the range of motion, which he has 28 degrees of lateral rotation, which is just outside of our normal range.
All right, this is the alternate test for lateral hip rotation. So we're going to perform this test by flexing the ipsilateral knee to 90 degrees while the contralateral knee stays fully extended. During this test, we're going to place the fulcrum for the Goni landmarks. Place the fulcrum at the anterior aspect of the patella with the proximal arm perpendicular to the ground and the distal arm at the midline of the lower leg. Let's see. Now when we laterally rotate the patient, we're gonna grasp the distal end of the lower leg and rotate them laterally. And with that, we have 34 degrees of lateral rotation, which is within normal range. With both of these alternate tests, you have to make sure the rectus femoris is not tight, or this test becomes null.